Today, I would like to talk to you about latent depression. It's a difficult topic, a complex topic, because you see, latent depression is one of those forms of mental suffering that is particularly hard to identify and diagnose. This is why, even today, if we look in the DSM-5, which is the diagnostic manual par excellence used to catalog psychopathologies, we see that latent depression is no longer indicated. It appeared in previous versions, but this designation is no longer present. There are others, but the concept of latent depression is nonetheless an extremely important one, and it is a form of mental suffering on which it is worth asking questions. And so, today, in this contribution, I would like to explain a bit about what latent depression actually is, what we can understand by it, and I would like to give you some signals, 3 important indicators that you can consider to try to understand if this form of mental suffering may somehow belong to you or to someone dear to you. In this spirit, here are some contributions that I like to make regularly. I would also like to give you 4 indications, or let's call them strategies or tools, that you can generally use to try to work on this delicate and important aspect of your life. Clearly, the contributions I make online cannot in any way replace the direct psychotherapeutic relationship between the professional and the patient, precisely because each story is different in the realm of personal well-being. Each of us is different. Each of us is unique, which is to say that the diagnostic categories, so beloved by insurance companies, are essentially the initial reason for the creation of these large manuals like the DSM-5. However, they do not find much space in a clinical relationship simply because each person is different. The nuances that can arise within each of us are so unique and rare that using monolithic diagnostic categories is not very helpful. Just a note for your knowledge here. The diagnostic categories, the DSM, essentially are the result of a series of events, particularly in America, post-Vietnam War, where soldiers returning home faced tremendous difficulties, not physical ones because they might not have had amputated limbs, but they presented incredible readjustment challenges. However, at that time, there was still no clinical terminology to categorize it, so the categories were completely lacking, including what we now know to be post-traumatic stress disorder, which is a structured, complex, and articulated disorder that clearly leads to a series of very debilitating damages, often more debilitating in some cases than specific physical injuries. Therefore, since then, thanks to the entire movement of categorization, it has been possible to diagnose these psychopathologies and thus also receive subsidies or reimbursements for this category of people so heavily impacted by trauma, in this case, American soldiers. Since then, various categorizations have developed and become much more refined. Some have been introduced while others have been removed, precisely because, in some cases like that of latent depression, it becomes extremely complex and difficult to identify the precise characteristics of this form of mental suffering. Essentially, as the name suggests, latent depression refers to a form of mental suffering that is somewhat below the threshold, which is not well recognized. A peculiar characteristic, which we will discuss further, is the person's inability to clearly identify it, precisely because it remains latent and hidden. It presents a series of symptoms that we can now understand better, but it is not evident, so it is not. A full-blown depression, like major depression can be. Sleep disorders, mood disorders, therefore clearly significant alterations in motivation, significant alterations in appetite. indeed a depressed mood that increasingly presents itself more intensely and with very prolonged periods of this type of internal states. Latent depression, on the other hand, is a somewhat subtler form. Typically, people who suffer from it are able to fully carry out their daily activities, manage to go to work, socialize, and handle various family responsibilities without any issues. They are people often very busy with their own activities who nonetheless exhibit a whole series of specific symptoms and carry with them a deeper sense of suffering that is in fact unnameable and uncategorizable. This somehow generates a constant feeling of having the handbrake on, a sensation of not being able to truly live fully the life that is their own. But let's see what the three indicators are, or at least the three characteristics, let's call them, that you can notice and keep in mind when talking about latent depression. So, the first one has to do with awareness. Typically, people who suffer from latent depression are individuals with poor awareness, not just in a general sense, but specifically regarding their own emotions, their internal states, and their awareness of what drives them internally. They are people who struggle to say they are well or unwell, unless in particularly striking cases or situations, precisely because they have developed a poor emotional introspection, or, as we will see a little better, have somehow set it aside and can no longer draw upon it. Therefore, they are individuals who carry on with their activities, perhaps sensing that something is wrong, but they cannot name it or define it within a clear meaning. The second characteristic element of this type of person, as seen in research, is that they are more prevalent in the male gender. This is also due to a factor related to socialization into the role. Men today do this much less, but in the past they were certainly taught to not express their emotions. Therefore, they could not express their emotions, as men do not cry, which made it clearly difficult to recognize their own emotions. It is particularly challenging for many men to achieve emotional literacy. Today I feel this way. Today I feel like this. Today there is this veil of sadness. And then being able to name it, categorize it, and perhaps associate it with other events. This is an emotional skill that is more generally related to a form of emotional intelligence that many people lack or possess in limited amounts. Along with this, as I mentioned, the second important symptom to look at is somatizations. People who suffer from latent depression or a form of latent depression tend to be individuals who can somatize a lot. Somatization is essentially a condition where the body expresses what the mind is unable to verbalize, unable to offer a clear category, and so the body stages that pain, that suffering. This is somewhat the case with latent depression, where we can have physical somatization, for example, with constant headaches, back pain, a sense of oppression in the chest, and gastrointestinal problems. These are all symptoms that are not typically very impactful in daily life, but are present and recurrent, symptoms on which the person tends to focus their daily attention. So, instead of being able to connect with themselves and understand what is actually happening, it is as if the mind displaces this discomfort onto the body, manifesting through these somatizations. These can then manifest clearly at a mental level with forms of increased anxiety, more stress, continuous worry, discouragement, a sort of, we can define it, a form of low self-esteem leading to constant rumination, a thought that is almost always somewhat present, regarding death. These are all forms that generally do not impact unless in somewhat more extreme cases, the daily life of the person, but that are always somewhat present, serving as a backdrop. Thoughts or somatizations or sensations that become a bit of the praxis, becoming a part of everyday life, becoming that constant background noise in people's lives. And the third important signal to consider, along with these other two, can indeed prompt some reflection regarding one's condition, is emotional flattening, affective flattening. And it is just as you see if a person who has experienced difficult events, perhaps, difficult in their life at a certain stage of it, simply may not be able to do so because they do not know how to do it, because they do not have the time to do it, or they do not have the opportunity to do it, and they cannot categorize what has happened to her in reworking it, in giving it a name, in giving it a boundary, precisely in identifying the sensations associated with it. Then that experience, that suffering experienced in some way, remains there. And you see our society, our culture as well, as I was saying for men, but in general, it is a culture that tends not to want to truly see things, not to really want to delve into them. Medicine, which is an incredible tool that we humans have, tends, especially from an allopathic perspective, to suppress the symptoms we may experience. For instance, I have headaches, I have back pain, I have these continuous joint pains, and I simply resort to a whole series of medications to limit this. Or I have these ruminations, and then again, medications. This can be particularly useful, especially in the more acute situations. In fact, it is especially helpful in some of them. However, clearly, if it is not accompanied by the development of narrative competence within the person to increasingly identify particular life events and the emotional states associated with them that are still active within the person, it becomes difficult and complex for the individual. So, here is what can manifest: a sort of emotional flattening, as if having experienced difficult situations, perhaps even at a young age. I once had a patient, for example, who was a successful man overall, someone who managed to achieve good things in his field, to excel, thus a hard worker, very much in demand as well, but essentially an unhappy person, someone with a whole series of specific somatizations, a person who, in the end, had never really given himself the time to reconstruct his own story, to connect the dots, to piece together all those fragments that, when viewed from a broader perspective, can somehow give sense and meaning to those somatizations, to those sensations, to that deeper sense of suffering. So here it is that this person, thanks to a more structured therapy process, was able to identify those paths, those stories, to pinpoint some of the primary causes that led them to develop this inability to recognize their internal states and therefore naturally to recognize what their needs and necessities were, which they had consistently set aside throughout their life, of somewhat pre-established, socially validated paths, which, however, did not satisfy that need for something more, something deeper. So here it is that in this case, that latent depressive form may have originated in a time long ago, but it had never really been taken into consideration. It had never been addressed. Typically, what happens is that during transitional phases, in this case, it was a situation where one was approaching retirement, starting to think in some way about what comes after work, right? And so in those transitional phases, life typically asks us to settle some accounts, those experiences, those incorrect postures which have now somehow become ingrained within us and are no longer even noticed, begin to resurface, causing suffering. In this case, it was about consumption, as I mentioned. So here is that emotional affective flattening that I may have consolidated over the course of my life due to various events, just to give an example. But there could really be many situations precisely because there are so many different people. However, that flattening is another important signal that must be taken into consideration along with this lack of introspection and this form of somatization. These are certainly not exhaustive indicators. There could be others as well. As I mentioned, for a diagnosis, it is clearly necessary to embark on a journey with oneself, of therapy, of self-work, of psychotherapy undoubtedly. However, in the spirit of these contributions that I like to create online, I would also like to give you 4 strategies, as promised, that can somehow help you, in a way, to work on these aspects of yourself. For each person, it is undoubtedly different, but there are a whole series of actions that we can take in life to make a little difference in our inner world. Why not to take charge of it and then start transformative processes that can truly change our existence profoundly in the long term? So here it is. If you have doubts and feel that you might have this somewhat latent form of depression within you, I suggest 4 simple activities that I believe can help, in addition to, of course, if you feel this deeper discomfort, starting therapy. So, the first activity I suggest has to do with the famous diary, but here is an emotional diary. What I would suggest you do is to get a nice diary, a nice notebook, and write down every day what you have felt, describing in words what you have experienced in the different situations of your life. Today I had that success. In that particular activity I felt so. Today I failed. In that particular activity I felt so. Today the relationship with that person and the feeling I experienced was a sensation of beginning to name, of shame, of pleasure, of attraction, of what happened inside me. I am starting to identify my emotions a bit. I am beginning to develop a capacity to name my internal emotional states. This is a very important first step. You see, sometimes, as I was telling you, to avoid some of the suffering generated by the experiences we have lived in the past, we simply tend to dull our ability to perceive our own emotions, developing a form of emotional flattening. But then, starting to pay attention to them is a very important first step to somehow reposition ourselves in our lives, to begin to perceive what is actually happening to us day by day. This is a very important aspect. The second suggestion, I feel compelled to give you, if you have known me for a while, you know that this is essential for me, so you may have already guessed what I want to say. If you have been following me for a short time, well, you will hear a lot about it. Meditation. Meditation is one of the most important components of life. Meditation changes our perception, changes our nervous system, changes our mind. I have spoken at length about meditation, so I will not elaborate further here. On my website, ericogamba.org, you can find a lot of material, and I also invite you to subscribe to the mailing list to receive updates on what I create and produce on a daily basis. However, the mailing list is only sent out weekly. And I was telling you that meditation, practicing every day, inevitably increases my ability for introspection, to recognize my internal states. I'll just say this: meditation is not an easy path. Not because it is complex to learn, but because it truly requires the sincere will to really know ourselves, to truly want to transform our lives. It is an act of courage as well as a great act of love towards ourselves. However, in a society that tends to anesthetize, to keep moving forward, clearly, meditation is somewhat counterintuitive because it means entering into a completely different therapeutic logic, which is not so much about repressing the symptom, about not seeing it, but rather about focusing attention on what is happening. The more I'm able to do this by focusing on my body, especially in meditation where one focuses on the breath as a basic technique, the more those sensations, experiences, and emotions can emerge, particularly in an initial phase. Practicing meditation can help us connect with what may be this form, sometimes even depressive, latent, present within us. Practicing it regularly and continuing to do so over the years is, however, a great practice that can truly change our lives. Mindfulness, in particular, is now considered one of the elite treatments for cases of depression and anxiety, specifically within mood disorders. Meditation truly helps a great deal in this. And the third suggestion that I feel I should give you is somewhat related to what I mentioned earlier. One of the practices that I believe we should all try to introduce into our lives has to do with reconstructing our story. This is a beaten theme. I have talked about it before, perhaps never enough. So, how much do we need to remember? Because some approaches say, just leave the past behind, live only in the present, and move forward like that. And mindfulness, if you want, is one of those approaches that focuses a lot on this. But you see, reconstructing the past, reconstructing history, is a process that needs to be understood. It is not about focusing on it, spending my whole life telling myself what was missing, what did not happen, but rather about recognizing those events in my life, those paths I have developed within it, which in some way have led to the construction of specific structures within me that I need to learn to observe. Because you see, if I do not observe them, I do not see them, and therefore I cannot even categorize them within my inner life. Those structures exist regardless. They act. They are just like mental or emotional postures that somehow continue to persist in my life. Emotional flattening, for example, I no longer feel emotions, but if I do not reflect on the steps that led me to develop this kind of emotional affective flattening, I might simply conclude that I am an unfeeling person, which is something many men do, for instance. And for that, but I have to ask myself what happened, what my story has been. Perhaps that patient I mentioned earlier comes to mind, for example, whose mother is very depressed. So you see, the issue is really about reconstructing the story. This is what is normally done in a well-conducted psychotherapy process. However, it is something that each of us can do, something for which each of us should also have the tools to do it. So, simply start telling me what happened, trying to understand, but I was happier before. Yes, what has changed, what happened, what occurred in my daily life, but what were perhaps the events? Sometimes it is easier to identify them because we may have experienced a traumatic event, which particularly impacted us significantly. From there, I somehow start to give a clear meaning to all the sensations I had afterward, to the somatizations, to the suffering, specifically to that negative emotion, that sadness. However, sometimes it is more complex because we may not have experienced a specific strong trauma that is easily identifiable. Instead, our structure may have developed as an evolution of a series of micro events that occurred in a specific period of our lives, which have consequently built that particular structure within us. I may have experienced a loss, and at the same time, I may have had a work-related issue. Then shortly after, I could have faced a physical problem that led to a series of issues that later developed into other concerns. So, if I am unable to process, to give a boundary, a shape to what has happened to me, in order to overcome it, not to remain stuck in it, of course, then I remain effectively tied to the past. Therefore, processing the past in order to let it go is something that is extremely, extremely, extremely important to do. Finally, the fourth activity I would like to suggest, if you have doubts about this somewhat latent depressive form, or if you suspect that loved ones might have this, is to seek out activities that do not overly engage. You see, Those who suffer from latent depression are often experts at finding many activities to fill their time. They might say, I do a lot of sports, I work a lot. But why? Because I don't feel that stuff down there, right? But rather something that is truly deeply fulfilling. And this is a criterion that is undoubtedly difficult to identify because sometimes we tend to rationalize, so truly every case is unique. But if I had to give you a piece of advice, it would be this. Try to find an activity that truly makes you happy in some way, that really satisfies that inner need for meaning, significance, and internal fulfillment that we all seek in some way. A depressive form that is latent but still depressive, a form where my entire dopaminergic system struggles to function well. So, if I can find activities that activate me, yes, that engage me, yes, but also that I truly enjoy, that give me satisfaction, that provide meaning and significance to my life, that lead me to say, well, if I were to die today, I would be happy because I did that thing, I carried it forward, I am happy to have done it. Finding these activities is very important because they help to counteract those deeper latent experiences over time, transforming them through continuous practice. For example, I could fall in love with kayaking because kayaking gives me so much. I am with friends I get along with very well. There is a whole organization involved. I am close to nature and I really enjoy this sport that I do for myself. This won't solve all my existential problems or the deeper issues, remote or latent depressive forms that I may have never truly faced. But it becomes, so to speak, a hook that somehow helps me to maintain a solid anchor of pleasure and well-being, thanks to which I may then develop the strength to tackle those somewhat unresolved issues. See also that at the beginning of psychotherapy in general, a good dose of ego reinforcement is useful and necessary, because when I feel a bit stronger, a bit more stable, I have found some of my sources of pleasure and well-being, and then I can face with greater serenity those parts of myself that I tend to set aside, which also scare me a little, which I fear. Here is clearly my clinical suggestion, but also my human perspective as a person based on my human experience. I believe that not knowing oneself is the worst thing that can happen to us in life. Even though getting to know oneself is difficult and complicated, it requires a lot of effort, commitment, and honesty, even with ourselves, because it is hard to be honest with oneself. But I think it is one of the most beautiful things we can do in life, perhaps the most important thing we really have to do in our lives. Well, I have given you a lot of information and shared many things with you. I hope all of this can be helpful to you. I invite you again, as I mentioned, to share this because it may also be useful for many other people. I encourage you to visit my website arikogama.org and subscribe to the mailing list to stay in touch and receive updates about my courses and activities. Thank you for listening to me so far and see you soon.